600, sponsored by Selco Heating and Air Conditioning.
Okay, we've got 8:38, Tony and Melissa in the morning. With us here on the telephone line is Dr. Fred Browne, Chief of Medical Staff at Griffin Health. And he's been kind of guiding us through here when it comes to the coronavirus. Dr. Browne, it's good to talk to you again. How are you?
Good. How are you, Tony and Melissa?
It's a pleasure to have you here once again. We now have more than 24 cases in Connecticut of the coronavirus. What are you finding at Griffin regarding COVID-19 patients?
Right now, we don't have any confirmed COVID-19 patients. So that's currently where we are. I would tell you that we have ramped up our screening, though. So people who are coming in who are appearing unwell, enough to have fever, cough, shortness of breath, significant illness enough to bring them to the emergency department, which we are not recommending that everybody come to the emergency department. We are testing quite a few more people, and it's a little bit easier to get the testing done, which has been an issue over the last couple weeks. So I could tell you that it's very likely that we're going to start seeing more patients who are testing positive for COVID-19, but that might be more of a discovery thing than an actual increase in the disease itself.
That's my next question. In order to have the test done, do you have to be showing some symptoms, or can a healthy person make an appointment or whatever? Could they come in and have the test done just to be on the safe side?
That's a great question. Thank you for asking that. This is a viral infection. So when you have a viral infection, you have to have the virus in your body, and then the virus needs to start replicating. So the virus will start shedding, and the tests actually detect the virus itself. So even if you've been exposed to a patient, it doesn't necessarily mean that you have that virus. It doesn't mean that that virus is now in your cells, and it doesn't mean that that virus is duplicating and shedding. So you have to have viruses that are shedding. The only way that we can detect that is if you have mild symptoms or symptoms itself. So you have to have symptoms to actually become positive.
And now, Dr. Fred Browne, who is with Griffin Health, my understanding is last time you and I chatted, we talked about how you have a very lengthy background in infectious disease, correct? You worked in that for quite some time?
That is correct, yes.
Okay, so have you ever seen anything quite like the coronavirus? And when I say that, I just think sometimes when we're talking about it in a news standpoint, you're watching every news channel, you're reading every news article, and you start to almost get just so bombarded with facts and figures and
right.
things like that, that you start to almost think, I got to be honest with you, if I'm being real. People have said things like, this is the end of the world, and so on and so forth.
Viral apocalypse.
Thank you. Exactly. And, and I find myself getting blue in the face and saying we're sharing this information so that we're aware of it. We could be, we can use precaution. We could be proactive. But there are actually people who truly feel that this could be the end of something. And I would just love to hear from you, from your professional standpoint, seeing something like the coronavirus. Obviously, it's serious. Obviously, it's something we need to really work at. But I mean, are we nearing some kind of apocalyptic ending? I know that sounds ridiculous, but you have no idea how many people ask this.
Absolutely. So interesting enough, there's a few points that are within there. So I guess to answer your question, have we seen this before? Let me give you an example that I had from one of our emergency department physician, Dr. Hendricks. So he saw a patient a couple weeks ago as this was starting. And he went in and saw this patient, and he tested the patient. The patient had a fever, chills, shortness of breath, some body aches. He went in and he did a nasal swab on the patient, and the patient had his flu test came back positive, and it was H1N1.
Oh wow! Okay.
Right. So
yep.
So get this. So he goes in and he tells the patient you have H1N1, and the patient's like, okay. So the point of the story is that H1N1 was a huge deal.
Yeah,
it was enormous. It was the viral apocalypse. But we got it under control, and it became part of sort of the normal viral illnesses that we get in reasonable seasonality. So I think this is a new virus to us as humans. It's not a new virus to the world. It's been around. It's a new virus to us. It has a name, and we are tracking the way that viruses spread throughout the world. This one has a little bit of a higher mortality and maybe even a little more of an infectivity rate. But this is very similar to what we would expect to see with a flu. So this is just like an influenza. So again, the symptoms are very similar. The treatment is I say treatment because there's not treatment, but the way you would treat it is very similar.
And what about, and again, this is not to put you on the spot, but I just think it's a great opportunity for, especially because we'll be checking in with you about this very often. I just think we have the opportunity to ask you. There are certain news outlets and there are people who truly believe, Doc, that the coronavirus was created by human, like that this was made in a lab in China and that it didn't spread from animals. I'm sure you've heard about this.
I have. I love that one.
Yeah. So, I mean, what would be your response? Because there really are people who, I'm not God. I don't know. I mean, I know from fact what I've read and what seems by science where it came from, which was open markets, animals, all of that. But there are people who truly believe that the coronavirus we're dealing with right now was made in a lab over in China somewhere on purpose. And I guess, in your professional opinion, for how badly and how quickly this is spread globally, is that even possible?
So I actually think that's a very interesting question. And you can ponder it, and I could, as you've mentioned, my background is in microbiology. It also has to do with pathology. I've spent a lot of time in a lab, and in all reasons, theoretically, you could develop a virus that is not a virus that could potentially infect people. But I got to tell you that it is more likely. Even though that sounds great and it's great for science fiction that you develop something in the lab, I have to tell you, and scarier or not scarier, it is more likely that it's going to happen in nature than it is in a lab. And I think that has to do with, and it has to do with a lot of the things that have happened in the world over the last, 100 years. I mean, we've become, we're more populous. There's more humans. We also, and we have to eat. So a lot of our agriculture is closer knit, having animals sort of stacked together. So what happens is there's a natural aspect of a virus who gets connects to animals. Those animals, will mix together these viruses, and then they'll spread those to the humans. So it has to do with close proximity to the humans, the increased amount of humans in the world, and then the amount of food that we have to eat. And honestly, a lot of the living animals are the biggest concern. I think the techniques for agriculture can be concerning. If you have a organization or you have a market, which is one, has exotic animals associated with it, eating bats or having bats associated with, which are known to carry almost every coronavirus without having any symptoms themselves. Putting a bat together with an animal that it never would have come in contact, and definitely not significantly, and then having people eat that or use that for medicine or anything along those lines, that is really the way it would transmit. So it really needs a biological agent or reservoir or vector to really move it along. So even though it's possible, it makes a heck of a lot more sense to me, given my background and knowledge, that it came from animals and then went to humans. And there's just to kind of keep going on this one, there's a great book, if you or your readers want to read about it, came out in 2012 called Spillover. Spillover is the term, the effect in which a virus spills over to humans and then it becomes a human-human transmission, and it includes HIV.
All right, Doc, we've run out of time, but I got to tell you, you're a very calming influence.
Right?
Yeah, very excellent. Really, some good stuff there. Thank you so much, Dr. Fred Browne, Chief of Medical Staff there at Griffin Health. One last question. You can't get the disease from drinking Corona beer, right?
You cannot. Actually, have you been to one of my talks? No. I have a great slide with a Corona beer and a bunch of Heinekens with a mask on them. So, no, not at all.
All right. Dr. Browne, thank you so much. And we'll talk to you again real soon, I promise.
Very good.
All right. You got it. WICC is 600.